Hey everyone, and welcome to the MediByte channel. As a healthcare professional right here at MediByte, I am so excited to guide you through today's explainer. We are going to be demystifying vaginal cysts and abscesses, and we'll be specifically focusing on the Bartholin and sciena glands in a really complete, detailed, and completely easy to understand way. Our goal is to break down the science using clear, calming medical facts, translating all that complex clinical jargon into something that just makes sense. So whether you're tuning in for your own personal health knowledge or you just love learning about how incredible the human body is, you are in the perfect place. I mean, have you ever wondered how a tiny blocked duct can cause so much trouble? Well, let's dive right in and find out.
So if you've ever felt a sudden, totally unexpected lump in a, well, highly sensitive area, you absolutely know that instant wave of anxiety that follows. It's completely natural to panic a little bit. But I want to reassure you right out of the gate, most of the time, these unexpected discoveries are just common, straightforward mechanical issues. They're really not terrifying diseases. Today, we're going to unpack the exact mechanisms behind these lumps, giving you the authoritative and reliable information you actually need to understand your body, completely minus the panic.
Here is our roadmap for today's explainer. 1. Meet your Bartholin glands. 2. When ducts become blocked. 3. The complication, abscesses. 4. Diagnosis and sciena glands. And 5. Effective treatment options. All right, let's jump right into section 1. Meet your Bartholin glands.
What's really fascinating here is the location of these glands. Your Bartholin glands are these incredibly small, round structures located in the vulva just near the opening of the vagina. And their main job? They secrete mucus that provides fluid for lubrication during sexual activity. Now, because they sit pretty deep beneath the skin and tissue, you normally can't feel them at all when they're working right. They just quietly do their job in the background. But what exactly happens when that normal function gets interrupted?
That brings us to section 2, when ducts become blocked.
Before we get into the actual plumbing of it all, I want you to hear this number, 3%. About 3% of all women are going to develop a Bartholin gland cyst at some point in their lives, most typically during their 20s. The crucial point here is that this is actually a really common gynecological issue. It's not some alarming rarity that you need to stress over. And actually, as women age, the likelihood of developing one of these cysts goes down.
Think of the gland sort of like a small pipe. When the duct, which is essentially the exit of the pipe, gets blocked, the gland doesn't just stop producing mucus. That fluid gets trapped, it starts to accumulate, and the gland swells up. And boom, that forms a cyst. Honestly, the cause of this blockage is usually a total mystery. But what you're left with is a lump that can range anywhere from the size of a tiny pea to literally the size of a golf ball. Since it almost always happens on just one side, you might notice the area feels a bit lopsided. But crucially, at this stage, the cyst is typically completely painless. You might feel some pressure for sure, but it shouldn't hurt.
Moving on to section 3, the complication, abscesses.
Let's compare these two directly. A Bartholin cyst, like we just talked about, is a painless fluid buildup. An abscess, on the other hand, forms when the fluid inside that trapped cyst actually gets infected, turning it into a closed-off area filled with pus. Now, the tone definitely changes here, because an abscess is painful, like often severely painful. The skin right over it is going to be tender to the touch and usually looks pretty red. Sometimes this infection can even spread to the surrounding skin and the tissues underneath it, which is a condition called cellulitis. If that happens, you might spike a fever or notice a discharge. That's a huge clear signal from your body that it is actively fighting an infection.
Let's cover section 4, diagnosis and sciena glands.
So when should you absolutely pick up the phone and make an appointment with your doctor? You need to see a clinician if the cyst continues to grow, or if it just doesn't go away after a few days of trying warm baths at home. Also, if that lump suddenly gets highly painful or you develop a fever, do not wait. Get it checked out. If the sheer size or the pressure of the lump is messing with basic daily activities, like sitting or walking, you need medical care. And finally, if you're in your 40s or postmenopausal, you really should have any new lump checked out. A doctor can easily diagnose this with a standard pelvic exam. They might culture the fluid to check for specific infections, or, especially for older women, they might just take a quick small biopsy just to rule out rare abnormalities like cancer, though again, that is exceptionally uncommon.
Now, while we are exploring the anatomy down there, I want to briefly introduce a related condition, a sciena gland cyst. Your sciena glands, which are also called paraurethral glands, are located right around the opening of the urethra. That's where urine exits the body, which is completely separate from the vaginal opening where the Bartholin glands are. Sciena gland cysts are actually very rare. They happen when those specific ducts get blocked. Usually they're tiny and you wouldn't even know they're there, but if they grow, they can cause pain during sexual activity or uniquely pain and hesitancy when you urinate. They can even lead to urinary tract infections. It's an important distinction to make because of the location and those very specific urinary symptoms.
And, finally, Section 5, effective treatment options. If you've got a Bartholin cyst that's causing little to no pain, your absolute best first line of defense is actually right at home. The gold standard here is the sitz bath. It's so simple. Just fill a tub with a few inches of warm water and soak the area for 10 to 15 minutes about twice a day. What this does is encourage that blocked duct to just open up and let the fluid drain out naturally. For a lot of women, a few days of this calming little routine is literally all it takes to make the cyst completely disappear. But, okay, what if this sitz bath isn't cutting it? Or what if you have a painful abscess? That's when clinical interventions step in. One really common in-office procedure is catheter placement. Your doctor applies a local anesthetic to completely numb the area, makes a tiny incision into the cyst or abscess, and pops in a small balloon-tip tube called a catheter. They inflate the tiny balloon inside so it stays put, and they leave it there for about 4 to 6 weeks. Now, I know that sounds like a super long time, but don't worry, you can go about your normal daily activities while it's there. The whole goal is just to keep the duct open long enough for a brand new permanent drainage opening to form naturally around that tube. For cysts that just keep coming back, or for those really stubborn abscesses, doctors might opt for a minor surgical procedure with a very intimidating-sounding name, marsupialization. But don't let the word scare you. It's done in an outpatient operating room under anesthesia. The doctor simply makes a small cut in the cyst and then stitches the inside edges of the cyst directly to the surface of the vulva. It essentially creates a small, permanent pouch, kind of like a kangaroo, a marsupial, that allows for continuous, permanent drainage. If you have an active abscess with signs that the infection is spreading, your doctor is also going to pair these drainage procedures with a round of oral antibiotics to knock out the infection completely. As we wrap up this explainer today, here is the absolute core takeaway I want you to remember. Bartholin gland cysts and abscesses are common mechanical blockages that modern medicine can easily and effectively resolve. Whether it's just taking a simple warm bath at home or having a minor clinical procedure, these unexpected lumps are highly treatable. There is absolutely no reason to be ashamed, and you definitely don't have to suffer in silence or panic when you feel something unusual. Basically, your body is just a very complex plumbing system, and sometimes a pipe just gets temporarily blocked. Thank you so much for trusting MediByte to guide you through all of this today. Before you go, just think about this. Our bodies are filled with thousands of these tiny, invisible glands, quietly working day and night to keep everything running smoothly. Which unseen mechanism do you think you'll discover next? If you found this straightforward, visual approach to medical science helpful, please take a quick second to hit that like button, share this with someone who might need it, and subscribe to the MediByte channel for more clear, empowering health explainers. Stay curious and stay healthy.